All right, we had British Member of Parliament John Hemming about how they kidnap your children if you complain about the Gardasil shot paralyzing them or killing them. That's Times of London. We have Dr. Russell Blaylock, MD, brain surgeon, neurologist, joining us, peer-reviewed, published expert on excitotoxins. And he's also written a detailed analysis of the entire 1,000-plus page bill that I went through the bill myself with his document and found it all to be devastatingly accurate. We've got Manny Badillo, We Are Change New York. Big news. They've got the city of New York to start a big court proceeding investigation of 9/11 and what really happened. They got 80-plus thousand signatures to do this. He's popping in for about 10 minutes. The Charlie Sheen world-exclusive video message of the president that we're releasing here, asking for a new investigation to the president. That's coming up the start of the next hour. And then popping in, historian Webster Tarpley in the last hour to give us his take on all the things that are happening. But I want to play this clip as we go to Dr. Russell Blaylock. This is Obama last night pointing to the Republicans. He aggressively looks at them. He's only about 30 feet away from them. And he says, it's not true that this funds illegals. Well, I've read the subsection. It just changes the name of the illegals. It's got all the interpreters for them. The feds already fund the states to do it with unfunded mandates, but they fund about a third of it. It's all in there about taking over health care. So I want to just have Dr. Russell Blaylock. I'm going to try to just shut up for 15 minutes. We have a airtime with him. And let him just rocket through it. But first I wanted to play this clip because he's calling them liars. Then they dare yell back at him that he's lying. And the media is spinning this in a mass hoax, because here's the headlines. Obama, time for bickering over on health care. It's bickering to question in our republic. You're not supposed to have free speech. The Democratic whip says the Democrats lack the votes. Poll hell. Obama disapproval on health care plummets. Will plan lead to forced unionization of healthcare workers? Yes, it will, under federal control. Flashback. Dems booed Bush during State of the Union. Flashback. Obama accused Bill Clinton of telling bald-faced lies. We have all those clips we're going to be playing. And then CNN spin speech. Poll sampled double the amount of Democrats to claim his polls went up. They did 1/3 Republicans, 2/3 in the poll, said it was an even poll of Republicans and Dems to skew the numbers. Caught red-handed in fraud, mainstream news, and CNN even admits it. I mean, this is off the charts. So let's play the clip of Obama, who's done nothing. I've never seen the president. He makes Bill Clinton look truthful. He makes George Bush look truthful, and I hated both of them. Here it is.
So those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. It's not true.
And we already know you're a liar. You said you wouldn't hire lobbyists. That's all you did. You said you were getting the troops out of Iraq. You took 50,000 out of Iraq, put them in Afghanistan, and then put 50,000 more contractors in. A 100,000 increase because they put another 40-plus thousand into Afghanistan. So it's a 90,000 increase. I want to be technical. The issue here is everything he says is a lie. Okay, I'm going to shut up. We got Russell Blaylock here. Sir, you've written a report on this. People can read. Give out your site, the name of the report. It's got it all linked and bibliographed. People can go read it for themselves. Tell us, sir, starting with the illegal alien coverage, what's really going on?
Well, what I found interesting in the bill was that they redefined illegal alien. They asked, in it has different things to strike out. To strike out the term illegal alien and redefine it as a person in the country illegally. Well, if you allow the person to stay here and work, then according to legal definition, they're here legally because you haven't expelled them, you haven't arrested them, they're not charged with a crime. Therefore, in judicial terms, they could potentially be classified as legal. They're here legally. So they made an effort to redefine that, and I thought that was strange. Now, if they're not intending to treat illegal aliens, why do they have at least 10 to 15 pages in the bill that's dedicated particularly to language for people who do not speak English? They even say all physicians will have to put signs in their offices in all the languages of the people that they'll be serving. it says that special interpreters will have to be used by all physicians, hospitals, medical facilities for people who do not speak English, and that these people cannot be family members and other people that you have that speak Spanish or other languages. They have to be specially qualified, knowing medical terminology so that they can interpret this for this person who does not speak English. Now, if we have all of this money being spent on interpreting language for people who do not speak English, who is it directed at? Well, it's not directed at legal immigrants. Most of them learn English. It's directed at the illegal immigrant. And, of course, every illegal immigrant can walk into any emergency room and get all the care that you can with top-dollar medical insurance or any kind of coverage. So they already have full access to all American health care. Under this bill, that would continue because it says no emergency room, no medical facility can exclude anyone for any reason.
So Obama, sir, is a bald-faced liar.
He's a bald-faced liar, and he knows it. Anyone who's even glanced at this bill, I mean, why would you have 10, 15 pages just on requirements that people have language interpreters readily available at every medical facility, at every level? Right now in physicians' offices, when I practice, you had to have an interpreter at your own expense. So I had to pay for the interpreter if a patient.
So this is really a non-issue. We already have total legalization of the illegals. Washington Post admits they pick illegals up in these raids and then take them and give them green cards. Homeland Security does. At these one time I cut my finger off, went in, and they kept serving the illegals while I had to have my insurance run. And I said, look, you better get a doctor and come reattach this finger before it rots off or you're liable. I see you running those illegals in there because you know they don't have insurance. I've got full coverage, Blue Cross Blue Shield of Minnesota, because that's my employer in Minnesota. I said, do it now. And they actually kind of snapped to. But as a citizen, I was a piece of trash.
Right. Well, this is true, and it's been true. And the other thing in this bill, it says the illegal alien does not have to pay the tax that all other Americans will have to pay. If you don't get health insurance or the public option, you have to pay a 2.5% tax. The illegal alien is exempted from that, even though they remain in the country and are working, some making quite a bit of money. They're exempted from this 2.5% non-compliance tax. Yet they get full access to every bit of care that you do. That's when I hear people say, oh, there's 50 million people who don't have access to health care. That's an absolute lie. There's not a living human being in this country that does not have full access to top-quality health care.
But it's kind of a secret for citizens. I had an employee who had really bad Crohn's and couldn't eat and was probably going to die. And I explained to him, I said, listen, even if your insurance has thrown you off, you've got to go explain you're a charity case. He went to New York, had one of the top Crohn's doctors, Dr. Kornbluth, do his surgery, all paid for, $80,000.
Right. And so, it's just a mess that you hear this continuously, and Obama says it constantly, as if these people don't have access to health care. That's just sheer nonsense. These uninsured have full access to every bit of health care that you do.
Well, sir, go through just some of the other bullet points in the segment we have left and the segment coming up. Some of the other things that are really in the health care bill. They keep denying that government's taking over doctors, that they're going to take money out of your check, and suddenly they're even admitting that now.
Well, the interesting thing that I hear all the time is that there's absolutely no rationing in this bill. Obama says that everybody connected with this on the Democratic side, Pelosi says it constantly. There is no rationing in this bill. Every page of this bill is rationing. Anyone who has ever even glanced at a socialist system anywhere in the world, intrinsic is severe rationing. As the system gets deeper in debt, the rationing increases. And this is what's scary about this bill. It leaves full discretion to the Secretary of Health and Human Services, which means once the bill's approved, then from then on, she can arrange it document it, change it any way that she wants to, including ratcheting up severe rationing. Now, I just listed some of the rationing things in this bill. For instance, the Secretary of Health and Human Services determines the payment rate for all physicians. All doctors are automatically in the public option unless they opt out, and the Secretary of HHS will determine the opt-out procedure, which may be quite complicated. There are numerous civil penalties all throughout this bill for physicians for overpayment, ER readmissions that are considered by her to be not justifiable, violations of rules, documentation, audits. All of these are just filled with civil penalties against the physician. Well, I can tell you as someone who practiced under Medicare and Medicaid